Hello and welcome everybody. Today in this forensic medicine class, we'll be continuing our topics on toxicology. And in this session today, we'll discuss on non-metallic irritants. And I hope that this session will be helpful to all of you to continue with your study so that we can finish our syllabus on time. Uh, so we have already discussed some of the topics on irritants in our previous classes. Uh, and this is the classification of irritants. Right? Poison as a whole is classified as corrosive agents, irritant agents, and systemic poisons. And irritants are further classified as organic irritants, which includes plant irritants and animal irritants, inorganic irritants, which includes non-metallic irritants and metallic irritants, and mechanical irritants. So among these, we have already discussed organic irritants and metallic irritants. So today we'll be discussing non-metallic irritants, which includes phosphorus and halogens like chlorine, bromine, and iodine. So like other irritants, the general symptom of non-metallic irritants are similar to other irritant poisons, which means that if they are ingested, they will produce symptoms of GI irritations. When they are inhaled, they will produce symptoms of respiratory irritations. And when applied over skin or mucosa, they will cause irritations of those surfaces. So among all these non-metallic irritants, first we'll discuss the phosphorus. And phosphorus is one of the important topic among all these non-metallic irritants. So phosphorus is a non-metallic element. So it is composed of two Greek words, phos, which means light, and phoros, which means bringing. So phosphorus literally means lightning, bringing of light. That means they are capable of lightning itself. They are capable of self-lightning. So there are two varieties or two forms of phosphorus, yellow phosphorus and red phosphorus. And among these two, yellow phosphorus is capable of self-burning, self-lightning. So yellow phosphorus, these are also called white phosphorus. So yellow phosphorus are yellowish in color. They are waxy, crystalline solid with a peculiar garlicky odor. So this garlicky odor is peculiar for phosphorus and other phosphorus containing poisons or compounds. Yellow phosphorus containing compounds. So these yellow phosphorus are luminescent. That means they will glow in the dark, and they are highly combustible. They are unstable and highly combustible. So they are and they are stored in water, because if they are exposed to air, they will oxidize and will burn, will ignite. So this is the yellow phosphorus stored in water. So yellow phosphorus is used in various industries like fertilizer industries, insecticides, rodenticide industries. They are also used in firework industries, and also used to make incendiary bullets and incendiary bombs, and also smoke screens. Similarly, red phosphorus, they are reddish in color, amorphous, and unlike yellow phosphorus, they are odorless. And these red phosphorus are more stable than yellow phosphorus. They are insoluble in water, and they are harmless, which means that these red phosphorus are non-toxic. So the toxic form of phosphorus is yellow phosphorus. So the poisons that contains phosphorus means that these poisons contains yellow phosphorus, not the red phosphorus. And the use of red phosphorus is in the matchboxes. So the striking surface of the matchboxes are made up of red phosphorus along with powdered glass. Similarly, there are various derivatives of phosphorus, uh, phosphoric acid, phosphine, aluminum phosphide, and zinc phosphide. So among these, most commonly available uh, forms are aluminum phosphide and zinc phosphide. Aluminum phosphide is used as insecticide. Uh, they are used as grain preservatives. While storing the grains, this aluminum phosphide is kept in that room, and they will release phosphine gas, which are toxic to the insects. Similarly, zinc phosphide are used as rodenticide or rat poisons. So both these aluminum phosphide and zinc phosphide releases phosphine gas, which is the toxic form when they are exposed to air or when they come in contact with water. So uses, we have already discussed the uses. They are used, phosphorus are used in match boxes, fireworks, they are military uses while making incendiary bullets and incendiary bombs. They are used as insecticides, rodenticides, and as fertilizers. The fatal dose of phosphorus is 60 milligram, which is approximately 1 milligram per kg body weight. So this slide shows the difference between yellow phosphorus or white phosphorus and red phosphorus. So white phosphorus is white in color or yellow in color, whereas red phosphorus is reddish in color. White phosphorus are translucent, waxy, and cylindrical in shape, whereas red phosphorus is amorphous, solid mass, or they may also be in powder form. Yellow phosphorus has garlicky odor and taste, whereas red phosphorus is tasteless and odorless. White phosphorus are luminescent, and they oxidize and ignite when exposed to air. Red phosphorus are non-luminous and they are non-flammable. White phosphorus are used as fertilizers, insecticide, rodenticide. They are used in fireworks and in making gunpowders, whereas red phosphorus is used to make sides of matchboxes. White phosphorus are highly toxic, whereas red phosphorus are non-toxic. Mode of action. So yellow phosphorus has both systemic as well as local action. Um, so these phosphorus, they are protoplasmic poison, which means that they will cause damage to the cell organelles, especially endoplasmic reticulum, which are required for protein synthesis. So when endoplasmic reticulum are damaged, uh, there is impaired protein synthesis, including various enzymes. So this is responsible for its toxic effects. Similarly, it is also toxic to liver and also to the heart. And when ingested, the oily solvent or oily vehicle will increase the absorption of yellow phosphorus. So since yellow phosphorus uh, is unstable, and they will ignite when exposed to air. So when applied over the skin or to the mucosa, they will cause severe irritations of the skin and can cause second to third degree burn. So poisoning of due to phosphorus can present as fulminant poisoning, acute poisoning, and chronic poisoning. Okay. They are present with fulminant features when people consume large doses of uh, phosphorus, usually more than 1 gram, and death is very rapid due to shock or cardiovascular collapse. And people usually present with restlessness, delusion, uh, thirst, nausea, vomiting, and drenching. Similarly, in acute poisoning, the patient will present in 3 stages. In first stage, there will be GI symptoms. In second stage, there will be the patient will be free from the symptoms. There will not be any symptoms. And in third stage, the symptoms will reappear. And in third stage, the patient will have symptoms of hepatotoxicity, renal toxicity, and with various cardiac arrhythmias. And in chronic poisoning is usually seen in people who are exposed to small doses of uh, phosphorus over a longer period of time. So clinical feature. So in fulminant poisoning, there won't be much symptoms because they will have a cardiovascular collapse and death is very rapid. In acute phase, there will be 3 stages. The first stage lasts for up to 3 days, and there will be the patient will present with abdominal pain, vomiting, diarrhea, and burning sensation of mouth and throat with garlic-like odor from the breath. Similarly, since this yellow phosphorus are luminous substance, the vomitus and the stool may be luminous. That means they will glow, and the stool may there may be some faint fumes emitting out from the stool. This is called the smoky stool syndrome. And this is one of the, this can be asked in your MCQ. Okay? So smoky stool syndrome is seen in phosphorus poisoning, yellow phosphorus poisoning. Similarly, in the second stage, this may last up to several days and the patient is free of symptoms in this period. And in third stage, the poisons are absorbed into the systemic circulation, and where the digestive system or the GI symptoms will reappear with increased severity, and there will be also symptoms of liver damage. So they can have tender hepatomegaly, jaundice, pleuritis, hypoglycemia, bleeding from multiple sites, so bleeding disorder uh, due to failure of synthesis of liver dependent clotting factors. Similarly, there may be hepatic encephalopathy, and where patient may be restless, ataxic. There may be flapping tremor, confusion, hallucination, delusion. There may also be fetor hepaticus, stupor, as well as coma. The patient can also have renal damage. So this can be due to direct toxic effect of phosphorus, or also due to hypovolemic shock due to diarrhea and vomiting. So they may present with oliguria, hematuria, albuminuria, and other features of acute renal failure. So these the phosphorus is also toxic to heart. So people can present with various types of arrhythmia, and they may also present with cardiogenic shock. So there may be various ECG changes like ST and T wave changes. There may be prolongation of QT interval in ECG. So ECG should be done in if you suspect phosphorus poisoning. And there, in severe cases, there may be pulmonary edema as well as acute respiratory distress syndrome. So the diagnosis can be done by garlicky odor in breath, luminous vomitus and stool, and other supportive findings like findings of hepatic and renal failure, ECG changes, and sometimes other toxicological blood investigations can be done to confirm the diagnosis. So another form is chronic poisoning. So they are usually seen in occupational due to occupational exposure of fumes of phosphorus pentoxide, who work in industries where yellow phosphorus are used. And there is a term called phossy jaw or glass jaw or Lucifer's jaw. So in people who are exposed, chronically exposed to these phosphorus fume, these people will have a condition called phossy jaw or glass jaw, eh, or Lucifer's jaw. So they will present with toothache, with swelling of jaw, loosening of tooth, and in severe cases there may be uh, ulcer in the skin of the jaw, exposing the bone, and with multiple discharging sinuses. And there may also be osteomyelitis of the jaw, and this is usually seen in lower jaw, the mandible. It may be there may also be some constitutional symptoms like nausea, vomiting, pain abdomen, weakness, weight loss, and cirrhosis of liver. So this is the patient with phossy jaw. There is atrophy, or there is a necrosis of jaw, lower jawbone, mandible, and there may also be multiple discharging sinuses in the skin of the lower jaw. So treatment in acute phase, the treatment is symptomatic, and there is no specific antidote for phosphorus poisoning. So gastric lavas can be done, and they can be done with potassium permanganate or copper sulfate. So gastric lavas should not be done with normal saline or plain water. And and other supportive treatment like IV fluids and inotropes for treating shock, whole blood or fresh frozen plasma if there is bleeding disorder due to liver failure, vitamin K for bleeding disorder, and it has been shown that there is role of magnesium sulfate. So magnesium sulfate has membrane stabilizing effect. So um, magnesium sulfate has shown that the use of it has been shown that the use of magnesium sulfate can stabilize the membrane, especially in the cardiac muscle, and it can prevent arrhythmias in these people. So it can prevent death. So when it is applied over the skin, the dermal burns can be treated with plain water or 1% copper sulfate. And do not administer milk, oily food, as it will enhance absorption of phosphorus. And for chronic poisoning, it can be treated by simply removing the patient from the source of exposure, and dental treatment with follow-up. Similarly, in autopsy, there will be garlic-like odor from the stomach content. There will be other supportive features like jaundice, multiple bleeding points on the skin, luminous garlic gastric content, congestion of skin and mucosa with enlarged fatty liver. And these specimen should be, and the viscera should be collected for toxicological analysis. And usually stomach with its content, a piece of liver, and half of each kidney are collected for toxicological analysis, and they are preserved in saturated solution of normal saline. Saturated solution of sodium chloride, and not in rectified spirit. So its medical legal significance: they are usually accidental poisoning in children, and they can be used as suicidal poisoning also, especially rat poison, and they are rarely used for homicidal purpose, abortion, and arson. So aluminum phosphate. So this is the derivative of phosphorus, yellow phosphorus, and this is commonly available since it is used as green preservative to preserve the grain when they are stored in large quantity. So aluminum phosphide is they are grayish green tablets. Each tablet weighs around 3 grams, and they are mixed with urea and ammonium carbonate. And the fatal dose is 1 to 3 tablets. So one tablet can be fatal, and the patient can die if only one tablet is consumed. So when this aluminum phosphide is ingested, due to moisture or due to water content or due to hydrochloric acid in the stomach, it will liberate, it will emit phosphine gas, and this is the toxic compound, and it can cause multiple organ damage. Sometimes this aluminum phosphide can also be available as in powder form. So the clinical symptoms features are similar to phosphorus poisoning. They have metallic taste, they will present with vomiting, diarrhea, and they have the vomitus has garlic-like odor. And there will be intense thirst, burning, epigastric pain, and diarrhea. And in severe cases, they will present with cardiovascular symptoms like hypotension, shock, tachycardia, arrhythmias, and ECG changes. There will also be features of hepatotoxicity after a few days, and the patient can also have respiratory distress due to pulmonary edema, coma, and death in later stage. So the diagnosis is can be done clinically by garlic-like odor in breath or in the vomitus, abnormal liver function test, and ECG changes. Similarly, there is a bedside test known as silver nitrate test. So in this test, a filter paper which is impregnated with silver nitrate is kept just below the nose of the patient, and as the patient breathes out, because of the phosphine gas which is present in the breath, it will turn the filter paper into black color. So the blackening of filter paper impregnated with silver nitrate indicates the presence of phosphine gas, and this can further confirm the diagnosis of aluminum phosphide poisoning. Okay. And for further confirmation, blood can be sent for toxicological analysis. So management is similar to phosphorus poisoning. So we'll manage circulatory shock. Respiratory distress can be managed by giving oxygen or intubation. We'll correct metabolic acidosis, and in aluminum phosphide poisoning also there is role of magnesium sulfite. So they will prevent cardiac arrhythmias. And gastric lavage is contraindicated because if gastric lavage is done with water or normal saline, it will cause further liberation, or it will further liberate the aluminum phosphide will be converted into phosphine gas, which will be absorbed into the circulation, and it will increase the toxicity of the aluminum phosphide. So autopsy features, it is also similar to that of phosphorus poisoning. So there will be garlicky odor in the gastric content, and there will be necrotic changes in the liver and kidney. Heart may show features of toxic myocarditis, and there may be features of ARDS, or pulmonary edema in the lungs. And these aluminum phosphide are commonly available, so they can be used as suicidal poisoning. Zinc phosphide. So the treatment sign and symptom are similar to aluminum phosphide, and they are used as rat poison or rodenticides. So next topic today is halogens. So in halogens, there are various elements, but we'll discuss iodine, chlorine, and bromine. So iodine are a crystalline element, like element. They are bluish black, soft, scaly crystals, and they have uh, metallic luster with an unpleasant taste. So when it vaporizes, it gives a violet color. So iodine is one of the is an trace element which is essential, which is required for our body to produce thyroid hormone. So we need iodine in our diet, and iodine is present in salt and sometimes milk, which are fortified with iodine. They're also found in inks, which are used in photography. Uh, so iodine has got it has bactericidal, sporicidal, protozoocidal, and cysticidal and virucidal effect or property. So they are used as antiseptic agents for cleaning the wounds, especially povidone iodine, also known as betadine. So this contains iodine. So iodine can also be used to treat thyroid cancer, especially radioactive iodine, for diagnosis as well as treatment of thyroid disorders, to see whether these thyroid nodules are uh, cancerous or non-cancerous. Similarly, anti-arrhythmic drugs like amiodarone also contains iodine, and these drugs, when used in excess amount, can cause thyrotoxicosis or hypothyroidism. So iodine is also a protoplasmic poison, and they can cause coagulation of protein and cause necrosis of tissue. The vapors of iodine are irritant to respiratory passages, and in the body, the iodine is converted to iodide, and they are stored in thyroid gland. So the fatal dose of iodine is 2 to 4 grams, and the fatal period is 24 hours. So in our diet, we require iodine, and the recommended daily iodine intake is around 150 microgram per day, and a healthy person can tolerate around 1100 microgram per day. So consuming more than tolerable dose can lead to iodine poisoning. So in acute poisoning, this iodine, when ingested, can cause uh, staining, yellowish staining of lips and mouth. It can also cause skin burns. Uh, there can be vomiting and diarrhea, and the vomitus and diarrhea stool may appear dark in color, yellowish, brown, or bluish. There may be pain in the mouth and stomach, mouth, esophagus, stomach. There may be intense thirst, salivation, uh, and the urine color of the urine may become red or brown. Okay? And there may be features of nephritis and renal failure. And when inhaled, these the iodine vapor or iodine fumes can cause irritations of the respiratory passage and can cause pulmonary edema. Okay? And they can present with cough and shortness of breath. And in severe cases, it can cause convulsive movements of limbs and fainting. So there can also be chronic poisoning of iodine, which is called iodism. So it can present with pain over the frontal sinuses, running nose, conjunctivitis, salivation, nausea, vomiting, purging, and there may be parotid swelling, which is called mumps, iodine mumps. There may be atrophy of breast and testis, edema of face, eyelids, which clears up as the iodine is withdrawn, or the exposure of iodine is discontinued. There can also be acne or erythematous patches of the skin, and there may be thyroid dysfunction, either hypo or hyperthyroidism. So treatment, so there is no specific antidote. So gastric lavage is done, stomach is evacuated by emetics or by gastric lavage, and 1 to 5% solution of sodium thiosulfate can be given orally, which helps to convert iodine to non-toxic iodides, and which will be excreted. Normal saline, an IV normal saline can be given, which can also accelerate the excretion of iodine, and symptomatic treatment can be done by steroids and antihistaminics for pulmonary edema. In postmortem appearance, the skin, there may be rashes in the skin, there may be erosions of mucosa in the mouth, esophagus, stomach, with edema of glottis. There may be edema of eyes, mucous membrane. Lips may appear yellowish or brownish. There may be inflammation or edema of the mucosa of stomach, intestine, and there may be fatty degeneration of heart, liver, and kidney, with acute tubular necrosis in the kidney. And the brain may appear edematous. So all these features, they are actually non-specific findings, and the actual confirmation will be done by toxicological analysis of the visceral samples. So medical legal importance. So they can be accidental poisoning in children, and during treatment, during dressing of burn patient with povidone iodine, or continuous mediastinal irrigation for mediastinitis by using povidone iodine. So in these people, this iodine can be absorbed from the surface, and they can cause poisoning. They can be rarely be used as suicidal poison, and concentrated form of iodine are corrosive in nature, and they can be used for vitriolase. And water can be made potable or drinkable by adding 2% tincture of iodine per liter of water. So the second halogen is chlorine. So chlorine is yellowish gas with pungent odor, and chlorine are used as used for cleaning surfaces. Okay? They are used to clean surface and disinfect those surfaces. So they are used as bleaching agent, water purification, sewage treatment, and in pharmaceutical and cosmetic industries. So chlorine can inhibit bacterial growth in water. So they can be used to disinfect swimming pool water and also drinking water. So there's a bleaching agent. So this bleaching agent is used to clean the surfaces and disinfect them, especially in hospitals. And this bleaching agent is sodium hypochlorite. So after mixing with water and after cleaning, this bleaching agent will release chlorine. So this chlorine can then act on bacteria or other agents and inhibit their growth. So the fatal dose is 50 to 100 ppm. So mode of action is they are oxidizing agent and cause extensive destruction of tissue, organic tissue. Poisoning usually occurs after inhalation of chlorine, the fumes of chlorine, or ingestion or contact with the skin and mucosa. So since they are inhaled, they will cause symptoms of respiratory irritation, So there may be irritations of throat, mucous membrane of respiratory passages with edema of larynx, glottis, and lungs. Similarly, there may also be irritations in the eye and nose and can cause rhinodia and lacrimation and sneezing. There may be violent coughing with yellowish expectoration. There may be extreme dyspnea, headache, nausea, vomiting, and spasm of glottis and abdominal pain. And there may be abdominal pulmonary edema. And pulmonary edema can be fatal. So this is an X-ray which shows pulmonary edema in patient of chlorine inhalation. So if somebody is working as a cleaner, and if they use chlorine as a cleaning agent, and if they do not know how to mix those the bleaching agent with water, or uh, if the concentration of that bleach is high, it will release higher amount of chlorine. So the person who is cleaning the floor or any surface with that bleaching agent, concentrated bleaching agent, can be exposed to this chlorine, and these people may have symptoms of pulmonary edema. They may develop breathing difficulty. Okay? And pulmonary edema can be so fatal that the patient can die within hours if not treated in time. Right? So it is important to recognize this condition. So if somebody is a cleaner, who works as a cleaner, right, and they present with breathing difficulty, you have to rule out this chlorine exposure to chlorine, right, and treat immediately. So chlorine can also be ingested. So when ingested, hypochlorous it is ingested in the form of hypochloric acid or hypochlorous acid. There may be burning in mouth, swelling in throat, pain in the throat, pain abdomen, vomiting, and blood in stool. And there may also be metabolic acidosis. So again, the treatment is supportive and symptomatic. We'll remove the patient from the site of exposure and we'll give them oxygen inhalation, nebulize the patient with sodium bicarbonate. Cough is treated with codeine and bronchodilators, and in severe cases of pulmonary edema, the patient may require intubation with mechanical ventilators. In autopsy finding, there is characteristic chlorine-like odor, okay? And there is inflammation of mucosa of respiratory tract with pulmonary edema, and there may be rupture of alveolar walls, hemorrhage, thrombosis in the lungs, lung beds, and increased viscosity of the blood. So the last topic for today is bromine. So bromine is also a halogen. It is a dark reddish brown liquid that vaporizes at ordinary room temperature, and it gives irritating fumes with very unpleasant odor. So bromine is used as a substitute of chlorine. So when chlorine is not available, bromine are used. Right? So bromine is used to fumigate. Bromine vapors can be used to fumigate and disinfectant any room or any surface. They can also be used as flame retardant, cleaning agent, dye, and in photography. They are also used in pharmaceuticals as well as bleaching agents. So poisoning occurs mostly by inhalation and sometimes by ingestion or through absorption through skin and mucosa. So absorption of bromine vapors by route other than inhalation is usually minimal. So most absorption occur through inhalation. So after the exposure to bromine fume or bromine vapor, the patient can have ocular symptoms like irritations of the eye with lacrimation, photophobia, blepharospasm, and on dermal exposure, it can cause irritation, inflammation, and blister formation of the skin. And in severe cases, there may be ulcers. So the dermal manifestations are called bromine rashes. So inhalation, it can cause symptoms very similar to chlorine exposure. There can be irritation of the respiratory passages, running nose, coughing, dyspnea, wheezing. There may be laryngospasm, glottal edema, trachobronchitis, peribronchial abscess, pulmonary infiltrates, which are consistent with chemical pneumonitis, bronchiolitis, and pulmonary edema. So they will also later on develop pulmonary edema, so which is fatal. And ingestion, so though ingestion is very unlikely, they can present with burning pain in mouth, throat, esophagus, and stomach, with brownish discoloration of tongue, buccal mucosa, uh, and there may be nausea, vomiting, and intense thirst with salivation. So there may also be chronic poisoning with bromine, which is known as brominism. So it can present with dermatological features like bromine acne vulgaris with papular or pustular skin eruption of skin of face, shoulder, and chest. There may be headache, running nose, watery eyes, uh, indigestion, loss of appetite, and constipation. So there may also be bromine psychosis, which may present with confusion, delusion, delirium, hallucination, and depression. And in severe cases, they can present with drowsiness, stupor, and coma. So treatment, so it is similar to chlorine poisoning. So remove the patient from site of exposure to fresh air. Gastric lavage can be done if the poison is ingested. Oxygen inhalation can be given, and in severe cases of glottal edema, tracheostomy can be done. Otherwise, the patient may require intubation, diuretics, steroids, and antihistaminics to treat pulmonary edema. So powder glass, so this is a mechanical irritant. Okay? So it does not have any systemic effect. It will not have any systemic effect, but it will have local effect. So if it is ingested, uh, it will cause irritation in the stomach and can cause mechanical trauma to the mucosa of the GI tract. So powder glass and diamond does not act as poison as they are not absorbed in the blood, but they can cause mechanical irritation of the GI tract. So fatal period can be very, and fatal dose are uncertain, and it can be diagnosed radiographically by doing an abdominal X-ray. So these powder glasses or the glasses can be visible as faint shadow in X-ray due to radioactive silica. So symptoms may be burning pain in throat, stomach, there may be nausea, vomiting, there may be constipation with tenesmus and bloody stool, and death may result from shock if the stomach and intestine are perforated. So there may be perforation of stomach and intestine, and the patient can present with features of peritonitis. So treatment is usually gastric lavage is not done because of risks of perforation. So if small amount of these mechanical irritants are consumed, then they can be treated by giving bulky foods, followed by emetics and purgatives, so that These mechanical irritants are uh, uh, are excreted through stool. But if large amount or big pieces of these mechanical irritants are consumed, then it has to be removed surgically. And gastric lavage is usually not done. It should not be done. So postmortem changes, there may be erosion of mucosa of mouth, esophagus, stomach, and small intestine, and there may be particles of these mechanical irritants, glass particles in the stomach and intestine. The stomach and the mucosa may be stomach mucosa of GI tract may be congested and inflamed. And in medical legal importance, they are rarely used for suicidal or homicidal purpose. And usually these particles, these mechanical irritants are mixed with some other food, other agents and other foods before consuming. And they are consumed by people who are suffering from psychiatric disorders for suicidal purpose. And occasionally they can be used for cattle poisoning. Thank you. I hope this session is useful to you. Thank you very much.